Hi, I'm Dr. Jeff from Kelowna Family Chiropractic and the 100-Year Lifestyle. Today I want to talk to you a little bit about posture. Probably the most common thing that I work on in the clinic is posture. And it used to be we only used to see bad posture in teenagers and definitely in adults. As you know, from sitting in school, as the years go on, from years of sitting at a desk, sitting at a computer, driving a vehicle, all those things. But now we're even starting to see horrible posture in young children with cell phones and iPads and all of these learning games that they do. That forward head position is becoming such a common thing, and there are so many health problems associated with that forward head position. So let me talk a little bit about the research. Research shows that for every inch your head shifts forward from neutral to this position, it's like adding 10 pounds to the weight. So many patients that we see, their head is shifted 3, 4, or 5 inches forward from where it should be, even in young children. So if you think about that now, if your head is shifted 4 inches forward, that's like hanging a 40-pound watermelon around your neck and functioning through your entire day that way. That forward head position has been linked to all kinds of different health problems, everything from heart disease to diabetes, ADHD, hyperactivity, and of course neck pain and surprisingly lower back pain. We often have patients that come in with lower back pain thinking that the problem is in their lower back. The problem isn't in their lower back. The problem is that their head is shifted so far forward, and because gravity is always pulling, that extra force on their lower back, it causes their lower back to hurt. So the correction isn't in treating or adjusting their lower back, it's in actually correcting their posture and their alignment. So let me tell you a little story about one of my patients. Her name is Mavis. She's been a patient of mine for about 12 years. She's an awesome lady. You would absolutely love her. She first came to my office because she was quite concerned about her posture. She was getting on in years. She was in her mid-60s, and she was starting to notice that she was starting to get a little rounded. She was very, very concerned because her husband's posture had really deteriorated. Her husband, Jake, had really seen his posture deteriorate over the last 20 years, and he had become severely hunched and rounded, and she didn't want that to happen to her. So when she came in, she asked if there was anything we can do. So we ran her through the basic exams and the computerized scans, checked her posture, and we found certainly that there were issues with her spine that we could address. She had also been to her doctor recently because she was starting to have a few of the health issues, and he wanted her to start taking various different kinds of medication. She didn't like the whole medication thing and wanted to stay as natural as she could, and asked if there was anything that we could do regarding those issues. And I said that I didn't know. We were going to work on her posture, we were going to get her spine in better shape, get her nerve system functioning at a higher level, and see what happened from there. Well, we're 12 years down the road now, and Mavis's posture has improved immensely. She tells me almost every time she comes in that when she goes to the gym, so many of her friends and people at the gym tell her that she actually isn't aging. Her posture isn't deteriorating like a lot of her friends or like a lot of older people that they know. And what is she doing about it? And she says, plain and simply, I go to my chiropractor twice a month, and that maintains the alignment of my spine. The other really neat thing that happened is all of the health concerns that she had and the medications she was on, she's been able to stop. And her health has actually improved. Mavis has been a great advocate for chiropractic over the years and has referred us all kinds of patients just because of the experience that she's had. A lot of times, part of the treatment program, Mavis started like a lot of our patients, started with 3 times a week, then over time cut back to 2 treatments, then to 1, also involved some nutritional work. Obviously, the spine is just part of what goes on with keeping and maintaining your health and of your nerve system. Nutrition is also very, very important. We need to supplement with some protein powders and some other nutritional things to give her body what it needed to heal and recover and maintain. Exercise is extremely important. Mavis is in the gym 3 or 4 times a week. And we know drinking the right amount of water and the right kind of water is critical to keep your hydration up and to be able to allow your body to heal and to get rid of waste. Thank you for spending a few minutes with us, and I have a little gift for you. If you look down below, there's going to be a link where you can download a posture test. This is a posture test that you can do at home with your spouse, with your family, with your friends, and you can start to get some idea as to if your posture is healthy and is where it should be, or if potentially there are some issues that could start to lead to problems down the road. So don't be crisis oriented. Don't wait for some sort of a health crisis or back pain or that hunched over posture before you decide to take action. That's the whole premise behind what we do with the 100-year lifestyle. By making healthier choices, you're going to live a healthier, longer life. And that's what we help you do by covering all the bases. By keeping your spine healthy, by looking at nutrition, by looking at all of the other factors, managing stress, things like that. So thanks for listening. I'm Dr. Jeff from Kelowna Family Chiropractic and the 100-Year Lifestyle. Live yours.